Communication with culturally diverse patients, presented by Colleen Palmer. Culture can be defined as a group of people that share the same beliefs, values, and practices. A group's way of culture is usually passed on from one generation to the next and contain patterns that guide actions and thinking. Some common cultural groups seen in the U.S. are Hispanic, African American, Asian, American Indian, South African, and Pacific Islander. Effective communication has been shown to improve patient satisfaction, compliance, and overall health. More than 30 million people living in the U.S. are from another country. More than 50 million people in the U.S. speak a language other than English. Nurses must be culturally competent to be able to deliver quality patient-centered care. To do this, nurses must be able to understand the traditions, values, and beliefs of different cultures, gain knowledge on how to communicate verbally and non-verbally with culturally diverse patients, show respect for cultural beliefs and traditions that may be different from their own, and be culturally sensitive by showing appreciation of the diversity of others. When communicating with a patient of a different culture, the nurse must consider the patient's language differences, verbal and nonverbal cues, and the use of silence. If a patient speaks a different language, then a skilled interpreter provided by the facility must be used. Terms of endearment, such as calling a patient dear or honey, can be considered disrespectful in certain cultures. Always ask the patient how they would like to be referred to as. Some cultures view eye contact as a form of paying attention, while others view it as rude behavior. This is why it is crucial to continue educating yourself on different cultural practices. BSN Essential number 6 focuses on communication. Effective communication consists of negotiating with the patient to determine what type of care they are willing to receive, conflict resolution to maintain a respectful nurse-patient relationship, and maintaining a positive relationship with the patient. Not everyone has the same view on healthcare. Even people sharing the same culture have diversity in their beliefs and definition of illness. It is important to assess each patient individually. Questions about customs, beliefs, and religion can help guide the type of treatment plan that is appropriate for that individual. The CUSIN competency of patient-centered care focuses on the patient's beliefs and values. Nurses should provide care that is sensitive to the patient's culture and have respect for the diversity of others. Determine the patient's beliefs related to illness, such as their definition of what illness is and how they believe it is treated. For example, some cultures believe that a disease or negative prognosis will occur to them if it is spoken about, while others believe if there are no symptoms of illness, such as cancer, then routine diagnostic testing is unnecessary. A patient's religion and diet also play an important role in their health care. Religious groups such as Jehovah's Witnesses do not accept blood products, but it should never be assumed that all individuals that share a certain religion also share the same beliefs. A patient's diet also needs to be carefully assessed. If modifications are suggested to increase well-being, the patient may be non-compliant if the foods or methods of preparing meals is not part of their culture. What are 2 ways that culturally competent care can be demonstrated in the healthcare setting?